Hi, everyone. Good morning. Thank you for being here. I'm so excited to be a part of this event. I'm so excited that this is the theme that you all have chosen for this year. I think it's extremely timely. It's one that's close, near and dear to my heart, certainly pertinent to every single one of us here in the room. And I'm really grateful to be a part and to have an opportunity to share my thoughts with you on this topic that I think is in some ways a tragedy sort of unfolding before our eyes, but it really hasn't kind of sparked the kind of discussion and action that I think it should. I do want to mention, in addition to the bio that Helen mentioned, I was formerly with ARP, so really glad to be here with colleagues, Alan Ormsby, among others. So really grateful to be here and again, focusing on this topic. So again, thanks to Helen, thanks to Ryan, thanks to all the organizers for this event. We're here today to talk about two concurrent and mutually impactful trends, both the aging of our population and our changing climate. Both of them have the potential to really radically disrupt how we plan for our communities, but they kind of differ to the degrees in which their changes are evident. For most people, but not all, there is little doubt that climate change is real, it's here, and it's really changing the way not just our communities function, but how we live our daily lives. In the U.S. and across the world, people now endure summers that are characterized by code red air quality days and winters by either too much or too little snowpack. Extreme heat and cold are becoming more common throughout the U.S. and across the world. Hurricanes are increasingly frequent, intense, and deadly, as we saw last week with Helene. Extreme rainfall and toxic air, wildfire smoke, now plague parts of the country that are unaccustomed to such conditions. We see clear evidence of the impacts that climate change leaves behind in the destruction in its wake. Here in the U.S., NOAA, the National Oceanic and Atmospheric Administration, tracks disasters, nearly all of which are climate-fueled, that results in at least $1 billion of damage. The number of these billion-dollar disasters has increased each year since NOAA started tracking, which is in 1980. On average, there have been about 8 events per year. In 2022, there were 18. Last year, there was a record high of 28. They were still counting this year, obviously, and potentially on track to best that record. These disasters include the full array of wildfires, storms, flooding, hurricanes, cold waves, and droughts, and reach nearly all corners of our country. Time and time again, we see that events of this scale lead to the loss of life and the devastation of homes and communities that will take years to recover from. This climate trend intersects with and compounds another one that's less talked about and maybe less apparent, which will nevertheless have a tremendous impact on our communities. As you've heard from our prior speakers, we are, as a country, certainly here in Utah and around the world, growing older. People over 65 are the fastest growing demographic. This is the first year of what's called peak 65, with 4 million people turning 65 every year now through 2027. 100 years ago, 1 in 20 people was over 65 in the U.S. Today, roughly 1 in 6 is. And a similar trend, albeit on a very different timeline here in Utah, as we just heard, is underway. Whereas about 8% of the population in 1980 was over 65, that's around 12% today, and by 2060 will represent 20% of the population. At a national scale, there's a figure that motivates me, and I think it should do the same for anyone who's really thinking about planning for our communities of tomorrow. And that came from a data report of the U.S. Census a few years ago that was shared that stated that by 2034, we will have more people over 65 than under 18 in this country for the first time ever. And in many parts of the country, that group will be increasingly diverse. These demographic changes represent really a significant tipping point among a sizable share of our population. Yet it's a topic that rarely gets the kind of media coverage or discussion that it deserves outside of rooms like this. As a result, many community leaders and advocates are left with a poor understanding of what this shift means and what older adults' needs are. Part of the reason for that is for that lack of focus and lack of action is that we lack a standard definition of who is an older adult. Unlike with youth, which legally ends at age 18, we use an array of milestones to indicate aging. Protection from age discrimination at work starts at age 40. You qualify for membership with AARP at age 50. You're eligible for retirement communities at age 55, and movie discounts at 60. Social Security at 62, Medicare at 65, and so on. That poor understanding is exacerbated by the fact that we live in a youth-obsessed culture where any mention of aging is usually accompanied by the word anti in front of it. Aging is something to be vigorously fought, not celebrated or even planned for. Our poor understanding of age is also complicated by the fact that older adults continue to break the mold and shatter images of what it means to age. We see people running marathons in their late 80s. Recently, a 90-year-old man became the oldest person to travel into space. Older adults continue to defy expectations and stretch the boundaries of what it means to age. But there are some inherent truths to aging when you look across the cohort that I believe are poorly understood among the general populace. Some of these you've heard from Mallory and from Ella. 1 in 6 live in poverty at a national level, either at or below the poverty line. 98% live independently outside of congregate facilities. Nearly a third live alone. 20%, 1 in 5, don't drive. A third have unmet travel needs. 1 in 9 live dementia or another form of Alzheimer's or another form of dementia. 40% have ambulatory limitations, and 80% live with 2 or more chronic medical issues. It's a shortfall for all of us when we fail to acknowledge these realities and let them inform our work. So we have these 2 big trends underway, each of which has its own set of institutions to address them. On the one hand, we've got engineers and data analysts and hazard mitigation officers and emergency managers working diligently to plan for the impacts of climate change. Meanwhile, we've got gerontologists and healthcare professionals and aging advocates and service providers planning and trying to serve an older, grayer future. That division of labor is often mirrored in local, state, and federal agencies that are similarly siloed. One set to oversee public works, regulate utilities, and manage emergency response, and a different set charged to promote health and healthy aging. And therein lies the rub. We've got these 2 or more siloed approaches responsible for tackling complex problems in their own right without a full understanding of how they connect. There is simply too little attention paid to the intersection between them, not enough focus on how and where climate change exacerbates risk for older adults, and a lack of urgency to take action in communities that are home to an increasingly large share of them. It's absolutely essential that the needs of older adults are better considered, because we already see what happens when we don't adequately plan for their needs. I'll attribute that failure to the blind spots that many of us have as planners, advocates, and community leaders about the needs of older adults, resulting in part for some of the dynamics I described before. Those blind spots also manifest in communities that are built without many or any transportation alternatives for non-drivers, as well as in a lack of adequate seating or shading for public transit users. Those blind spots are evident in parks and public spaces that are designed without adequate seating or restrooms. They're also revealed in our lack of housing designed for accessibility and affordability in order to serve people with disabilities or account for changing needs. Looking at communities as a whole, places that fail to prioritize older adults' needs or even account for them are not likely to be places where older adults can age well and thrive. Instead, our failure to provide effective and affordable housing, transportation, and public spaces can lead to isolation and loneliness, declines in health, and financial vulnerability. And all of these realities have the potential to be further amplified by climate risks. I would argue that nowhere, really, are the consequences of our failure to plan for the needs of older adults more apparent than when you think about the impacts of climate change and climate-fueled disasters. Among the largest named disasters, we see time and time again that older adults bear the brunt. Hurricane Katrina, California Camp Fire, heat domes that covered the Pacific Northwest, winter storms in Buffalo, New York, Hurricane Ian, the Lahaina wildfires, most recently the summer's Hurricane Beryl, and many more. For more than 2 decades, hurricanes, winter storms, wildfires, and extreme temperatures claim a far greater share of older adults' lives relative to the fact that they represent roughly 20% of the population. Older adults die at double, triple, or quadruple the rate as people who are younger. This trend line, and the fact that it remains virtually unchanged for 20 years, makes it painfully clear that we are failing to create communities that safeguard older adults in their times of greatest need. And I guarantee you that in a few weeks, I'll be able to add Colleen to this list, sadly. It's not like we haven't been told this was happening. News stories almost consistently reported on these tragedies. It's heartbreaking to see the magnitude of these failures, and yet it's also easy somehow to overlook the human scale of the devastation. So as I mentioned, there have been a number of stories that talk about the death toll of older adults in tragic events, but very few stories that I've seen at least seek to understand and explain their experience as individuals wrestling with these climate-fueled disasters. This story is an exception, so I want to share it with you. Last year, the Washington Post published a story about the Lahaina wildfires in a way that painted a picture for what the fire really meant for the older adults who live in that community. Now, Hawaii may look very different from Utah, but the experience of a wildfire approaching a home in a community, I think, is something that we can all relate to. This story focused on the experience of people living in an affordable in a senior housing complex that was directly impacted. The complex was comprised of about 35 units, which were designed to provide safe, independent, affordable living for Hawaiian elders. The development itself was designed as one-level apartments, so in many ways exactly the kind of housing options that we're looking for. They were navigable for people who used walkers or wheelchairs. They fostered a sense of community among residents, at least one of whom had been previously unhoused before securing a spot in this development. This development, which was a Section 202 HUD-subsidized property, was designed to enable people to live independently for as long as possible. But it's also important to describe what this facility wasn't. It's not a facility that bore any responsibility for notifying or transporting residents out of harm's way, many of whom no longer drove and relied on friends and families for mobility. It was not a facility that was designed to ensure that people could access help when they needed it. It was designed for people to be independent. Many staff did a cursory notification about the wildfire and then left as flames approached. So when the alarms went off belatedly to notify residents about the impending fires, many scrambled to get rides to leave. Some set out on foot, unable to get far. Others were reluctant to leave because they had no place to go, or had pets or in-home medical equipment that they relied upon. All of these conditions contribute to the ultimate death rate, in which 73% of the people who died were over 60, including the lovely Miss Louise, who's pictured here, who is 98, but who had lived independently in the complex for more than a decade. It's hard to ignore these tragedies, and yet it's also difficult to mobilize action to solve them. Likely, due to the repetitive nature of these disasters, however, there has begun to be some focus within the aging world about the risks that climate change poses for adults. In June 2021, AARP dedicated its member-facing bulletin to the topic of climate change. That gave rise to another resource that was geared more towards local leaders that I helped to shepherd when I was there, called the Disaster Resilience Toolkit, which we co-branded with FEMA at the time. But more recently, AARP's Public Policy Institute released a framework called Aging Well, which is meant to support master plans on aging, but which failed to discuss climate change as a factor to be considered. In summer 2022, the American Society on Aging focused its Generations Journal on the climate crisis and added fighting climate change as one of its 4 policy priorities. And earlier this year, the Gerontological Society of America released a special issue of their publication, The Gerontologist, focusing on climate change with several in-depth peer-review pieces, including one on how age-friendly plans in the community and state levels could better account for climate-related risks. So we're having some mixed experience in the aging world in terms of examining how climate intersects with older adults' ability to age in place. But change is also slow to come in how our emergency response and climate resilience planning systems also consider aging. There are 2 major federal agencies responsible for emergency response and climate resilience planning, FEMA and HUD. Both have some ways to go in integrating aging considerations into their work. Let's start with FEMA. One of the most significant tools that FEMA uses to help communities and states assess their risk and develop plans to mitigate that risk is their State Hazard Mitigation Plan, which all states must complete in order to be eligible for FEMA programs. There's only nominal focus placed recently on integrating socioeconomic and demographic factors into that analysis, and it falls well short of asking planners to consider age and the share of older adults in the community as part of that analysis. There's no mention, even in the updated version from 2022, of the need to engage aging services or disability services as part of the required stakeholders for consultation. Therefore, it's possible to be fully compliant with the updated FEMA Hazard Mitigation Plan guidance without ever asking and answering the questions: how is our population changing? What is the nature of older adults what is the share of older adults in our community, and what is that trajectory? Where do they live and how do they get around? What are their needs in the face of our changing risks? HUD also plays a critical role as the administrating agency of billions of dollars in community development block grant funds specifically allocated for disaster recovery. This is an incredibly flexible and important source of funds for communities. I'm a HUD alumna and a huge fan of the important and innovative work that HUD does, but I nevertheless feel it's important to call out the shortcomings that help to explain the challenge we face. As some of you know, the Consolidated Plan is the document for communities to articulate how they will spend their CDBG and CDBG-DR dollars. But again, here, it is entirely possible for a community to deliver a compliant plan without ever considering older adults' needs explicitly. That's because HUD's charge is to serve low and moderate income households and address, quote, unmet recovery needs following a disaster. It indicates the needs for grant recipients to serve vulnerable populations, but it doesn't define them per se. Moreover, in identifying critical partners and data tools for grantees to consult in crafting these plans, it completely overlooks the role of federal, state, and local agency that are responsible for delivering aging services. That lack of consideration for aging concerns in these two federal agencies is problematic, and it's indicative of that siloed approach that I talked about before. The results of that oversight is that, for the most part, our current national approach to risk mitigation and climate resilience doesn't account for the unique challenges of adaptation that many older adults experience. It leaves too many people falling through the cracks and underserved or wholly unserved. And it fails to acknowledge that age is often a risk magnifier for people, overlaying other challenges associated with income, health inequities, or lack of access to people or services. Let me give you a few examples of what I mean by this. I want to start by painting a picture of what I mean when I say that older adults face challenges to adapt, and also how older adults are left unserved or underserved. After presenting to another audience in a small college town in upstate New York, I was approached by an older woman who lived in the community, and she'd listened to my talk, and she came up afterwards to share her story with me. She lived in her home of many decades and had planned to remain there as she aged. But the new flood maps for her town had been released, and she found that she was now in a floodplain. This wasn't the result of any particular disaster, as I understood it. It was in response to FEMA updating their maps with new data to better reflect future risks. As a result, FEMA was now requiring her to elevate her home, which she seemed unwilling to even consider because of how difficult an undertaking that would be. Alternatively, she was told she could get flood insurance to the tune of thousands of dollars a year, which she couldn't easily afford on her mixed income. She frankly found the whole experience with FEMA to be stressful and overwhelming. And this was a comparatively good situation where she still had a secure home to live in. As a result, she planned to sell her home. A neighbor was scooping up homes as they went on sale, and she seemed relieved to at least have that option. But this whole arena of elevating homes or rebuilding after disaster or investing in resilience to make one's home safer is an area that is ripe for fraud and abuse of older adults, particularly when they're faced with a high-stress environment or a high-pressure situation like this one. The second story I'll share represents sort of another facet of this dynamic in which people are left unserved. It's a situation that is sadly becoming increasingly common, in which extreme weather and rainfall results in damages to homes that don't rise to the level of a full-throated FEMA response and won't show up on that billion-dollar map I showed earlier. I was approached about a December 2023 disaster in Ventura County, California, where an atmospheric river damaged almost 500 homes, largely occupied by low-income families, undocumented people, and older adults. 3 inches of rain dropped in 45 minutes, causing widespread flooding and damage to homes, making them uninhabitable and dangerous. No one had flood insurance because they weren't in a floodplain. This was a freak event intensified by climate change. And the damages were not covered by homeowners insurance. Many also lacked adequate auto insurance that would have recovered the cost of replacing the cars that were totaled because they became inundated with water. The costs to repair the damage in just the home started at $30,000 because residents had to remediate asbestos that was already present in many of these older homes. But the actual costs were far higher because flooring, doors, walls, electrical systems, and appliances would all need to be replaced. One might assume that because this is a clear disaster by conventional definition, FEMA relief would be available to rebuild. But unfortunately, the event was too small to trigger FEMA relief, which has a threshold for 1,200 units damaged to trigger programs. There was only 500 in this case. The city and the county and philanthropy stepped in to try and provide support, ultimately raising about $500,000, $1,000 per household. But the only pre-existing federal program that was offered and was available was Small Business Administration loans. But many older adults who needed the help couldn't access that capital because they lived on fixed incomes that didn't include any capacity to take on loan repayment, while others feared that the loan would cause them to lose their homes entirely if they defaulted and couldn't repay the loan. The Lahaina, Ithaca, and Ventura examples that I talked about may seem isolated, but they aren't. Nor are they limited just to coastline communities. Similar examples of older adults being underserved or unserved are evident in the aftermath of Hurricane Beryl in Texas this summer, where extended power outages led to the deaths of more than 36 people, of whom 3/4 were older adults. An NPR story just last month explained how heat is impacting older residents in Montana, where 1/4 of the population is already over 60. They described how a 1% jump in temperature results in a 1% increase in 911 calls, many of which are made by older adults who need help navigating the heat. That may seem small, but when you think about the fact that temperatures can grow to 5 or 10 degrees over normal, that means hundreds more emergency calls are being made across a rural, scattered landscape for an already stretched, thin public safety team. All of these cases are ones that illustrate how the risks that communities face continue to evolve. And sadly, they also demonstrate how the systems to respond to those risks are slow to change. For older adults who live in the community outside of congregate facilities and often alone, as we've heard, the challenges of navigating these dynamics, whether that means evacuating or dealing with new flood map requirements or rebuilding after disaster, are generally left to the individual to solve. This would seem to be a natural role and opportunity for community-based organizations to help. But they too are often overwhelmed in the face of disasters or frankly not equipped to provide the kind of support that's needed. That certainly was the case in the examples that I talked about. But the importance of community-based organizations cannot be overstated, especially when you think about the fact that 98% of older adults live in their homes in the communities. At a national level, only 2% of older adults in the U.S. live in congregate facilities like nursing homes. For many older adults that live in the community, and those 30% of them who live alone, aging in place means relying upon a web of help from others for meal delivery, transportation, and companionship. This is where community-based organizations like villages and church groups and AAAs and neighbors and family and friends all play really critical support roles. But it's rare, perhaps outside of family that is, that sort of support extends to more complex tasks, like the task of helping older adults relocate or repair flood and storm damage or elevate their home. Those tasks go well beyond what many community-based organizations are equipped to provide. Of course, many older adults have the support of families nearby or children to help, particularly those from groups that have a tradition of multi-generational living and or family-based care for the elderly. But that isn't the case for all. Increasingly, nationally, older adults are childless. Whereas 11% of people over 75 have no kids, 20% of the younger older adults, aged 55 to 64, do not. So let's turn to those 2% of people who live in congregate facilities for a second. They may enjoy more support to respond to the stressors brought about by climate change. That is certainly more likely to be the case for those who live in facilities that provide responsible, safe, and affordable care for older adults that enhance their quality of life. but that is certainly not the case for everyone. Many congregate facilities do have robust, tested, and effective means to protect their residents from climate risks, but not all do. You may be haunted, like I am, by some of the pictures that were shown during Hurricane Katrina of wheelchair-bound older adults submerged in water in nursing homes. Since that time, there have been efforts at the federal level to ensure that facilities better serve such residents and are held accountable when they don't. That largely takes the form of a 2016 federal policy called the Emergency Preparedness Rule that requires any institution that is funded by Medicare or Medicaid prepare for disasters. But that too has its limitations. First, it doesn't apply to senior housing complexes like the one I described earlier in Hawaii, because that was not funded by Medicare or Medicaid. That and thousands of other HUD Section 202 units, which are designed for low-income older adults, to allow for independent living, don't provide any health care and therefore are not covered by that rule. Second, efforts were made to roll back the requirements in the Emergency Preparedness Rule in a prior administration, leading to a patchwork of states across the country of how it's implemented. As a result, some states more stringently enforce the policy, and other states take a more hands-off approach. In the worst case, this can have deadly consequences. In Louisiana, following Hurricane Ida in 2021, 15 people died when they were evacuated from their nursing home to a warehouse in compliance with a plan that met the letter of the law, but nevertheless failed to protect older adults. So I want to circle back to that third shortcoming that I named before, that our current approach to risk mitigation and resilience doesn't account for the layered risks of age on top of other vulnerabilities like income or health or mobility. The reality is that climate change is already contributing to changes in older adults' health and financial well-being in ways that differentiate them from other age groups, especially when you consider how that intersects with risk exposure. Let's focus first on financial well-being. We've heard before about housing. I think we could all agree that housing is fundamental. Housing stability and affordability is the foundation of health, well-being, and safety, so it merits some special focus. Late last year, the Harvard Joint Center for Housing Studies reported that the number of older adults who were paying more than 30% of their income for housing, making them housing cost burdened, is now at a record high. This applies to both renters and owners. In 2021, 56% of older renter households across the U.S. were cost burdened. And as we heard previously, that holds true here in Utah, where nearly 6 in 10 older renters are paying more than 30% of their income on housing. Still, with this much pressure on housing costs, very little wiggle room remains for other expenses, including preparedness or recovering from disasters. Part of the reason that housing costs have increased as a share of income is because the cost of insurance and utilities are rising, driving the true cost of housing higher and making it more volatile than ever, which poses still additional risks for older adults on fixed incomes. Already, older adult-headed households struggle to afford utilities. A 2020 study reveals that 7 million older adult-headed households say that they had to forego food or medicine to pay utility bills. That means that someone suffering in a home or an apartment that is too cold or too warm is making real-time decisions about how much they can afford and how much discomfort they can withstand. Reports also show that high energy burdens are more likely to impact low-income households, where they're spending 8% of their income on average, compared to 3% of annual income spent on utilities for the average U.S. household. These high energy burdens are more likely to impact Black, Hispanic, and Native American households, as well as renters and residents of manufactured housing. Older adults represent significant shares of all of those groups, especially residents of manufactured housing. There are some public programs that exist to try and address this problem. LIHEAP, for example, and weatherization programs aim to offset the cost of utilities for qualified households, but needs often exceed available funds. They may only cover heating expenses as well, with little or no provision for the increasing need to cool homes as average temperatures rise. In addition, it's well known that the cost of homeowners and hazard insurance premiums are increasing, as we develop more data-informed projections about risk. Hazard and homeowners insurance companies are reducing their coverage and raising their prices, and in some cases, leaving markets altogether, causing downward spirals in home valuations, which spells double trouble for the older adults who have all of their savings for retirement tied up in their home equity, and yet don't have sufficient disposable income to take on those higher cost premiums. With new data-informed maps, FEMA is adjusting the cost of the national flood insurance premiums, and they're rolling out those increases slowly. But it still means that some homeowners are going to see their premiums increase 18% every year for more than a decade. In real terms, that means that someone in Louisiana who's a homeowner would see their flood insurance rates grow from $840 a year to over $5,400 a year. I mentioned that some subsidy programs exist to offset the cost of utilities like LIHEAP, even though it's frequently oversubscribed. But I'm not yet aware of any programs that have sought to fill the gap on insurance. The result is that older adults simply go without insurance or woefully underinsure themselves, adding to their risk and vulnerability in the face of climate disasters. But it isn't just in the form of higher utility bills and insurance bills that our climate-fueled conditions are impacting the well-being of older adults. Climate is taking a toll on older adults' health as well. Flooding and extreme heat are some of the most difficult aspects of our new climate normal for older adults to adapt to. Increased flooding that can result in repeat inundation of homes leads to black mold that in turn contributes to poor indoor air quality, which then exacerbates respiratory challenges. But it's periods of prolonged heat in particular that are deadly for older adults. Extreme heat is now the leading cause of weather-related deaths in the U.S., killing more than all weather-related causes combined. Heat-related illnesses led to 12,000 deaths each year, and of those, 80% are people over 60. We saw this in stark relief in the Pacific Northwest heat waves of 2021, where 1,000 people died. In the most impacted county, the average age was 68. That's because older bodies don't process excess heat the same way as younger bodies. And for the 30% of older adults who live alone, they can be at greater risk because fatigue and weakness from heat exhaustion go unnoticed and therefore untreated, or because they mimic other health conditions. Extreme heat can prevent people from leaving their home to get groceries or medical care because it's simply too hot to go outside, especially for those who no longer drive and rely on walking or public transit to meet their needs. A story this spring broadcast here in Utah projected that 200 million older adults will face extreme heat risks. That's problematic not only because of the health risks I described, but also because it leads to droughts and wildfires, which in turn create even more complex conditions for older adults. Smoke from fires and toxic pollutants from dried up water bodies, like you all know here in Salt Lake City, exacerbate respiratory challenges and can increase the odds of heart attack, especially for people who are overweight or diabetic. Extreme heat, of course, also requires more air conditioning, which in turn drives up the cost of utilities, which in turn means more demand on the electric grid that can lead to extended power outages that can be particularly harmful to people and their caregivers who rely on in-home medical equipment. When the grid becomes overloaded, blackouts are the result. Blackouts are, of course, an inconvenience for everyone, but they represent a true hazard for older adults. And when they last several days, weeks, or months, as has been the case in Texas recently, and Louisiana and Puerto Rico, and likely will be the case in North Carolina and Georgia, those risks multiply. Long-term power outages in Puerto Rico tragically showed how people of all ages are left without access to clean water, fresh food, and basic power. But it's among the elderly in particular that the higher death toll results. That's in part because the lack of power is felt more acutely by people who rely on in-home medical equipment like oxygen machines or lifts. It's felt more acutely by older adults who live on the upper floors of multifamily apartment buildings, who, without backup power or without the ability to navigate stairs, become effectively trapped until the power comes back on. This happened in New Orleans after Hurricane Ida in 2021, when several such buildings were left without power for weeks. Tragically, this ultimately led to the death of at least 8 older adults, prompting the city to respond by adopting new policies that now require backup power in buildings where there's a concentration of older adults living. So, That's a lot. I hope that by now you're asking yourself, what can we do about it? I was at that point myself back in 2022 when I started to dive into this topic, ultimately taking the form of the book, Climate Resilience for an Aging Nation. Drawing on lessons learned throughout my career and even more learned during my year of research, I finally landed on 3 big takeaways that I think begin to lay a pathway to solutions, particularly as you chart a path forward, thinking about how we can support aging in place here in Utah. First, we have to be clear-eyed in our understanding about how climate change is impacting older adults and accept that in many cases, it impacts them more greatly. That has to start with more commitment to understanding who older adults are and what their needs are. I often ask people to imagine the difference in needs between a healthy, engaged, financially secure 62-year-old and an 89-year-old living alone in substandard housing with chronic medical conditions and no savings. Or a grandparent living comfortably with her child and their family, compared to one who's caretaking for a spouse with dementia. Older adults are a varied group in ages and abilities, and more racially, ethnically, and linguistically diverse every year. Therefore, climate resilience plans have to be built on a foundation that seeks to understand how the financial, health, caregiving, connectedness, housing, and mobility needs of older adults intersect with their climate risks. Second, we need to recognize that individual and even institutional preparedness is not enough. One conclusion that I reached from my research is that these tragic lives lost aren't often the result of people's inability to prepare or failure to prepare. More often, they are the result of unrealistic expectations about what it means to be prepared for someone who lives on a fixed income or who cares for a homebound family member or who can't drive. They are also the result of systems-wide failures that impact the whole community, but especially older adults, and therefore must be dealt with at the community scale. Third, these and other reasons are why we need to lean into community-wide resilience. I say the same thing to nearly every audience, which is that all sectors and all disciplines have a role to play here. Emergency managers, housing advocates, transportation planners, healthcare providers, utilities, and especially aging advocates. This is no longer a job for any one sector or profession. It is a job for all of us. Furthermore, I believe it is the job for all of us. After all, we all have older adults in our lives whom we love, and we all presumably hope to live in a community ourselves where we will be safe and secure in the face of a changing climate. We are not on a path at the moment to create such communities, and therefore really need to redouble our efforts to build community-scale resilience. So what is it that we mean by that, by community-scale resilience? It means thinking differently about our infrastructure, gray infrastructure, green infrastructure, and our social infrastructure. It includes more resilient housing construction, especially in age-targeted housing. It means a more diverse transportation network for the roughly 1 in 5 people over 65 who don't drive. And it would include multiple modes of communicating about disasters and supporting older adults in disasters by leveraging community-based connections. So we'll talk about each one in turn. Investing in climate resilience certainly means investing in more hard infrastructure, things like seawalls and levees prone to flooding, to protect communities, and more thoughtful and well-maintained stormwater systems that better manage extreme events while also delivering better environmental outcomes. But it also means more green infrastructure. We heard about this earlier, both on-site for properties and in the public sphere throughout a community to better manage flooding, as well as to create more green space for residents. It means more trees throughout a community to combat urban heat island effect, lower indoor air temperatures, and make it possible for older adults and people of all ages to safely navigate public spaces on increasingly hotter days. And it also means investing in more renewable sources of energy and a more resilient grid that can keep the power on and withstand extreme conditions. Community-scale resilience also includes more housing options, not just to respond to the current housing crisis that we face, but also to project and look forward to adjust to those climate risks and demographic changes that are coming our way. It calls for more intentional investment in creating affordable, accessible, and green housing options. That can be accelerated, as Ella described before, by zoning changes that allow for smaller, more dense housing that steers development away from high-risk areas By encouraging construction of things like accessory dwelling units and missing middle housing solutions, you ultimately offer greater choice for people in where they live and how they age in place. You also cultivate a more organic social network that can help in times of disaster. These efforts can be bolstered by incentives and building code requirements that encourage greater use of green building standards like LEED and Energy Star that reduce energy and water use and foster healthier indoor air conditions. And community resilience would, again, also integrate a more intentional approach to utility planning that accommodates rooftop and community solar to lower household costs and ensure a more stable source of energy. Community resilience would also deliver a diverse transportation network that includes public transit and fosters biking and walking to provide safe, affordable, and reliable options for non-drivers. That means robust public transit, bikeable and walkable communities that are safe for everyone. That would include streets and sidewalks that plan for accessibility with adequate seating and opportunities for rest, shading for transit stops, and well-maintained sidewalks for people who walk and roll. It also means that more focus is applied to identifying appropriate vehicles for non-drivers and people with disabilities in times of disaster. That includes emergency vehicles and others that are used to transport people are accessible and they can handle larger, heavier assistive devices. It would include shared use agreements that permit sharing vehicles, buses and vans and the like across entities in ways that are predetermined and pre-negotiated. And it would require that human service transportation planners, the folks who use Section 5310 money from DOT for paratransit and the like, are taking into account disasters and planning for them now. That is not currently required in all states. Some states do, but not all. Finally, community resilience would also include multiple modes of communicating about disasters, keeping in mind the significant share of older adults who aren't internet savvy or who live with disabilities or who speak a language other than English. It means bolstering the ability of grassroots groups to support residents with person-to-person support and things like resilience hubs within walking distance of homes, as illustrated here in the Community Lighthouse model in New Orleans that I talk about in my book. In that situation, a local community-based organization called Together New Orleans is working to create a series of these resilience hubs, which they call community lighthouses, in churches and other community-facing buildings. Those are powered by renewable energy and have battery storage on site. They serve as cooling and warming centers depending on the need, and as a place to get power, food, and water. What makes them so unique is that they've also thought about how people get there. And they've coupled it with a strategy that really utilizes volunteers to go out and knock on the door of every person in the service area to make sure that they know how to get to the lighthouse and that their needs are known by lighthouse staff before they arrive so that their needs can be met. There are a lot of natural synergies between these principles and the social impact end goals that are envisioned in the state's Master Plan for Aging. I understand that the Master Plan for Aging may not be a widely known tool or effort that's underway. There is a draft, as I understand it. Talk to Alan Ormsby for more detail about this, but many states are utilizing a Master Plan for Aging to really articulate the vision for where they want to go and how they want to support communities become more age-friendly. Of the goals that are mentioned in that draft plan, many make a lot of sense. They're things we all seek and aspire to. And they're related to some of the strategies I talk about. You can't have a functioning age-friendly ecosystem or live well every day without infrastructure and homes that protect people and reduce risk for residents. Affordable, accessible housing and transportation options are critical to being able to age affordably. Personal empowerment, as envisioned in the Plan for Life goal, is wholly dependent on being able to live in a resilient community that adapts to changing risks. And the networks for care and accessible technology that are envisioned are part and parcel of an improved communication approach during and before disasters. To achieve this new vision of community resilience, many partners, some of whom may be new and unconventional, are needed. Utilities, for example, are needed because they can implement payment systems that lower seasonal cost spikes that may cause older adults to go without adequate heating or cooling. They can encourage greater energy efficiency in homes and the use of renewable energy and battery storage to provide power when the grid goes down. Healthcare professionals can proactively address the topic of climate change in the course of medical care so that older adults and their caregivers better understand the risks of longer, hotter seasons or poor air quality days, especially as they relate to underlying medical conditions. Home health aides can be trained to help their clients better prepare for climate-related risks and identify interventions in the home that can make them safer, like backup power generators or air purifiers. Emergency managers and climate resilience planners can more explicitly incorporate aging in their planning, not just for older adults who live in facilities, but for the vast majority who live in the community, often alone. They can engage in new and nascent age-friendly planning efforts and serve as a resource and as leaders to advocate for more risk-informed housing, transportation, and infrastructure solutions. And aging advocates can recognize that climate change is central to their work. They can educate and train the industry, integrate climate considerations more routinely into how programs and services are delivered, and they can make themselves known to other sectors as experts and establish relationships that cultivate a greater understanding of and consideration for older adults. When these and other disciplines center their work around how to reduce climate change risk for older adults, we create safer and more resilient places for everyone. I want to end on a positive note. This spring, a historic vote came down from Europe's top human rights court that represents a potential sea change in how governments act with regards to climate change, and it was rooted in the needs of older adults. The decision was the result of a court case brought about by a group of Swiss women, all aged 65 or older, called Klimaseniorinnen. They argued that their government had failed to take adequate action to protect them from the risks of climate change, particularly extreme heat. And then in doing so, that violated their human rights. They won. The court case cannot be appealed, and it will have ripple effects throughout Europe and potentially the world in due time. Their success gives me hope, because when we work to solve for the needs of older adults, we also solve for the needs of people on limited incomes, or who can't drive, or who live with disabilities. We solve for those who are often overlooked and not heard because they are isolated, either by choice or by circumstance. We also solve for the needs of our future selves by creating systems community-wide that better account for our changing abilities, needs, and risks as we age. With that, I say thank you for listening, and I look forward to your questions.
Okay, here we are at Q&A. So we have Brian and Saskia who will be running mics. So if you have questions, just raise your hand and they'll come over. And if you speak into the mic, hold it close, then we'll be able to hear you and Danielle will respond. So do we have any questions? Great, we have one right here.
Have you encountered any communities that have done a really good job of creating plans for seniors that we could look to as templates?
Yeah, in the book, I focus on 3 communities as case studies. I know people always roll their eyes when I mention Portland, Oregon, because everybody rolls their eyes when you mention Portland, Oregon. But nevertheless, I talk about them in part because they were a very early adopter of the age-friendly framework. So 20 plus years ago, they decided to sort of use this age-friendly vision as an infrastructure for planning. And what makes that different is that they had already sort of centered many of their planning efforts in the needs of older adults. When the heat waves came along in 2021 and 2022, they were able to sort of leverage not just the city role, but also the role of the county, which plays a really critical role because that's where the AAA resides. In this case, it was also where the emergency management functions reside. And they were able to work together to kind of bridge that gap between often how cities and counties intersect. So that pre-work that they had done in terms of the age-friendly commitment was really a value to them. Then they also leveraged what they learned in COVID, which was that they needed to be able to use community-based organizations to get services and resources into the hands of older adults where they were through trusted intermediaries. So whereas a group had previously been serving older Asian Portlanders that's to, once upon a time deliver COVID kits and masks, that same group was now being tasked to deliver support in a different way. And that support, the climate responsive support that they identified was, in this case, mobile air conditioning units. It was a program that was being offered by the city. They worked with the county to identify how to get the word out to older adults, particularly low-income older adults who had medical conditions, who were then prioritized for receiving these mobile air conditioning units in a way that directly responded to what they learned in the first heat wave. So I offer that as an example of how some of these systems and relationships can be put in place that point the way to solutions.
Next, we have one right here up there.
Thank you for an excellent presentation. Building off of what you just said, I was wondering if you have an example, because we learned so much lessons from COVID, and how important it is to be flexible, both at the bottom level, but at the top level in terms of the policy. And I'm interested in the transportation aspect. You mentioned that shared use agreement I think it's very important that we set that, the framework in place in response to any sort of these disaster planning or the resilience building. Have you seen any examples any successful example from around the country that translated some of these COVID, planning that translated to this climate resilience planning?
The examples that come to mind are, there's an example, I want to say from Tempe, Arizona, that sort of thought about how to use their public transit buses in a different way. So they ended up doing mobile cooling centers. Rather than asking older adults to come to the cooling center, they brought the cooling center to them, which I thought was pretty creative use. And number of other communities, I think, have adopted that same model. The other example that comes to mind is the state of Washington, which actually required, going back to that sort of nerdy, DOT Section 5310 paratransit funding program, the state intercepted that to say, you have to, when you're planning for paratransit, you have to make sure that there's a plan in there for disasters. And I think that's an unexplored opportunity for a lot of states to think about utilizing the existing transportation resources that they do have and thinking ahead about what might that paratransit response be in times of disaster. I also would say that, the role of sort of informal transportation networks like volunteer driver programs is essential. And they're not always the most effective resource in the case of a disaster. You can think about the wildfires in Northern California or Hawaii, where can be difficult to activate a volunteer driving program. But the point is, you have to kind of look at all the resources and figure out how can we move people who are unable to move themselves in a really time-pressured situation and under extreme conditions. And I think that's where those early conversations, I think there's an old axiom in the emergency management world: you don't want to exchange business card on the day the disaster strikes. You want to know who your contacts are well before. That's at the heart of what this resilience planning really is all about.
I have a question myself, actually. So as Mallory mentioned this morning, we have time here in Utah to plan for this, which also means that the aging population we'll see by 2060 is going to be very different from our aging population now. And in a lot of ways, I'm thinking about how maybe our youth are riding transit more and have higher technological competency. So how do you see planning for an aging population changing as the skills that belong to the people who are then aging in the future? How do we plan for that? I'm thinking about, programs that target the younger, older adult population and get them more engaged with transit early, so that by the time they become older adults, they already have that skill and comfortability built in.
I mean, I think you kind of offered the answer there yourself, right? In a way, it's really getting people of all ages to become involved in the planning process. I think transit's a great example. I think, many of us, last time maybe we used walking as a daily mode of transport or bus is college. And after that, you can afford to get a car, you get a car and you never look back, sort of thing. So it becomes an unfamiliar or even foreign concept to think about using walking or public transit as a primary mode of transportation for some older adults, because that hasn't been their experience for many decades. But there are ways to solve for that. And I think that's where, again, bringing a lot of people of diverse ages into a conversation about how can we activate our transportation system better? How can we involve more older adults in the planning process? That's going to results and sort of deliver some interesting solutions when you have a wider array of people at the planning table. And I think, part of my hope with this sort of talk and the book is that it gets all of us thinking about that future now in the same way that you all are doing this conference. It's not too late to think differently about our housing, our transportation, our infrastructure, our community support infrastructure to reduce risk. And so let's seize that moment now before it's too late.